Okay, so today we're gonna speak about the one of the competencies that you have to be aware of, which is the intrapersonal communication, or what we call doctor station or hospital setup station, and etc. Okay, all of today's stations will be like in hospital setting, or most of in all of the cases you will be dealing with another healthcare professional like the physician, nurse, or a pharmacist student. This will be the situations of today, stations of today. Okay, so yes, so one of the specifics of doctor stations, more or less, it's similar to like the regular stations, like when you are dealing with a patient or something, but here you don't have to use like the common language. You can use the professional language. You can ask about hepatic problem, renal problems. Okay, you have to ask about that. In some cases as well, it would be of benefit that you are if you are asking about if the patient is like inpatient or outpatient. So this could be helpful in terms of the medication that you're gonna dispense. If you have an severe infection or something, and the first choice like intravenous infection, so this type of questions will be like a helpful here. If the patient is like hospitalized, then it would be okay to give like intravenous injection. If the patient is outpatient, so you have to go with oral options. Okay, this is like more or less, we do recommend, one of my recommendation usually at the end of the station, it would be it would be very important as well to mention that you can contact the patient or communicate with the patient to give him a proper consultation about how to use the medication, the expected side effects, and etc. How to manage the side effect, when to get back to the physician, and something like that. So at the end of the station, make sure that you can make like a proper follow-up, a proper consultation to the patient when needed. And just to mention that to the healthcare professional that you are dealing with, don't need any permission to contact the patient. You are a healthcare professional as well. But just mention that you to the physician, for example, if you would like me, doctor, to contact the patient and give him a proper consultation about the medication and how to use it, the best time of administration and something. Okay, I can do that to make sure that the patient is following the right steps to take the medication. Okay. So I don't see any other like differences between the regular or the common station and the healthcare professional station. To wrap up, to put all what I mentioned like in a nutshell, make sure that you are asking about kidney and liver functions. These questions could be pertinent, could be relevant. Make sure to ask if the patient is inpatient or outpatient. Check if you have any like lab works data or something, go through them. It's very important. Last thing, mention that you can follow up with the patient and give him proper consultation and the needed awareness of the side effect, and even you can follow up with the patient later on. Okay, to make sure that the medication is effective, safe, and the patient is compliant with the medication. Okay, this is like what I need to mention here. In the last session, we were we were talking about the SOS. The SOS is still valid here. The systematic OSCE scheme, this is still valid here. You can even follow the SOS in certain cases according to the situation. If the new medication or the doctor is asking about like advice about a new medication, it would be of benefit as well to follow the SOS. Okay, this is what I have to share or contribute here for the healthcare professional stations. If you would like to add something, Gazouly, please go ahead.
No, you covered everything. It's okay.
Okay. If we have any colleagues here who's attending for the first time, would you please just make a sign? Do we have anybody here who's attending for the first time? Mariam Shahata. Okay. So would you give a brief? We have Tracy as well. Okay. Would you please give a brief, Gazouly, how it works here? Yeah.
Okay, so as we said before, so this session we're gonna tackle the professional collaboration. So you as a candidate will come across stations between a pharmacist and either a nurse, a doctor, stuff like that. So usually it can be considered one of the easiest stations, and you can find yourself one of the stations can be done properly and way earlier than the 7 minutes. So don't panic if this happened. Just make sure that you cover everything. That's the most important part. All the points has to be covered. All the concerns has to be covered by yourself. Okay. So we have today around like 4 stations. So we're gonna pick up like one of the voluntarily willing candidates to participate with us. So if he did well, so we can go through with another, or he did like not good, so we're gonna go through with the same station with another candidate, and then we do the discussion. Okay. Try as much as you can to gather all your thoughts and be organized, and then we can start. Okay. So now is station number 1, and if someone would like to participate, and then he can raise his hand, and then we can go ahead.
Yes, for this station, I'm gonna send you guys the reference to the Telegram group. Okay.
Is everybody's like Arabic speaking, or is there anyone like cannot understand Arabic? If that
we have Tracy as well. I think Tracy she's not Arabic speaking.
Okay, no problem.
Maybe other colleagues, I don't know. So here we go. For the reference of this station, guys, I'm gonna send it to you on the Telegram group. Make sure that you are following the group. Oh. Sent. Okay, this will be the reference here. Okay. So station 1 will be that you will have a patient profile. Okay, and you will have some options in front of your office. Okay, this is a available option in your pharmacy. Here we go. So I'm gonna keep the time. I'm gonna watch the time. Gazouly, would you do that? Would you do the station?
Mohamed, you can start with this one. I forgot it. Sorry.
Okay. No problem. So can you keep the time?
Yeah, I will keep the timing. Okay, I got it here. So we're gonna do the 7-minute station. After 5 minutes, I'm gonna inform you guys that's 2 minutes left. So if like to wrap up everything. So that's okay.
Very good. So who's the first candidate? You can raise your hand.
So anyone want to participate? Well, someone has to participate. Okay, Karen. Okay, go ahead. So you have, I'm gonna leave you like 10 to 15 seconds to read the note and everything, and then we're gonna start, okay?
Okay.
Thank you. Okay, I'm gonna start at 10 to 15 seconds now, okay?
Okay. Where is the door note? Hi, I'm Karen, pharmacist on duty. How may I help you?
Yes, hi. My name is Jennifer. I'm a nurse here in the hospital. And actually, I would like to ask you how to convert the patient. We have here a patient. The patient file is here just with me. The patient name is Madame Laroche, Stephanie Laroche. She has been operated with knee surgery 2 weeks ago, and she was prescribed like hydromorph, okay, 2 milligrams for her pain, post-operative pain. But I believe that she's not well controlled with this. She went up for 12 tablets per day. She's taken 2 tablets for 6 times daily, up to she's taken about 24 milligrams of hydromorph every day, and we would like actually to convert her to another opioid. So I'm asking if you have any proposal to us, any suggestion, that would be much appreciated.
Okay, so regarding Stephanie, the reason for switching is that the current painkiller is not controlling the pain, correct?
Correct.
Okay, so you would like to switch to another one just to control her pain.
Yeah, any other medication, either like a opioid or any other option you may propose, just to control the pain for about 2 weeks or 3 weeks.
Okay, and can I know the reason for her pain, like why she's
As I said, it's a post-operative pain. Post-operative pain, yeah.
Okay.
She has a problem in her knee, and her physician, the surgeon, will be back in 2 weeks.
Can I know how severe is the pain?
It's tough. According to her, on like a metric scale, it's about 8.
8. Okay.
Yeah.
And
8
how is her kidney function is good?
Yeah, she's fine.
And liver function?
All is good.
All good. Okay. I can see from her profile that she's taking anti-arrhythmia and blood thinner. Is her condition is well controlled?
Yes.
Okay. So give me a couple minutes. I will check my reference and I will get back to you, okay?
No problem.
So total hydromorph is 24 milligram per day.
Correct.
And as the pain is 8 out of 10, so I would like to keep giving her opioid.
Okay.
I would like to keep giving her opioid.
No problem. Go ahead.
How about she was taking tablet, correct?
Yes.
Did you, yeah. Did you try IV or fentanyl patch? Yeah, 24. Yeah, I would like to go through fentanyl patch. I think this will be good for her, and as she was taking hydromorph for more than 1 week, correct?
The hydromorphin's about 2 weeks now.
2 weeks. So yeah, I think fentanyl patch will be a good option for her, as it will control her background pain, and we can use it 1 patch every 3 days. And we can start with the okay, I couldn't see. Yeah, here you go. 24. $25 milligram microgram, 25 microgram per hour. Or we can go to the lowest dose, 12.5 microgram per hour. This is a good option.
2 minutes left.
Is it okay?
Which one?
That 12.5 microgram.
12.5 milligrams. Okay. I'm
Okay.
afraid that she, yeah, you didn't. The problem is, she was talking like she talked before, like smoking cessation therapy, and she was taking as well the Nicoderm, the patch, and she got like very itchy. She got very itchy on the skin. She tried that about two or three times with different patches, and she got this problem usually. I don't know if it's gonna be the same problem with fentanyl or no.
I'm not sure about that. I need to check, but I don't think it will cause her allergy, as it's different. I'm really not sure.
Okay.
But we can try first.
Okay.
If you get allergic, we can change to another route of administration.
Okay, no problem. We can go ahead with that.
Okay. Anything else you would like me to address?
The dose, what would be the dose here?
The 12.5. We will start with the lowest dose.
Okay, it's once daily or what?
No, it should be used every 3 days.
Yeah. Okay.
Okay, and we can add
Time is up.
immediate release the opioid controlling breakthrough pain.
Time is up. Time is up.
Okay. Thank you so
Time is
much.
up.
Okay.
Okay, thank you, Karen, so much. Is there anyone willing to do the same thing, the same station, please? And then after that, we're gonna discuss it.
Yeah, this is the reference, guys. You should have it. Okay, go ahead.
Tracy, do you would like to participate?
Sorry, I didn't get the reference. I'm in the group, but I didn't see the reference. Maybe I'm in the wrong group.
Are you in the
channel?
Telegram group?
Yes, a Telegram group, PharmaFree channel, but I cannot find the reference.
Okay.
Mohamed, you are in the OSCE group? What the title?
Maybe it's not. Oh, it's called a channel. PharmaFree channel.
No. It's not this one. We have another one. It's called the. Wait, I'm gonna send you guys here the link to the Telegram group.
All right, thank you. I think Sarah sent me the reference. So it's all good.
No problem. Anyhow, here's the WhatsApp group, the Telegram group, excuse me.
Okay. Thank you.
Okay, no problem.
Yes, I would like to try. Thank you.
Okay, I'm gonna start the 10 to 15 seconds so you can read whatever you want.
Right. Okay.
No need to 30 seconds. We're gonna read
Yeah.
over this, right?
Okay.
This is what you say?
Yeah. Let's start.
Yeah, let's start right away.
All right. Okay. Hi, I'm Tracy, the pharmacist on duty today. How may I help you today, doctor?
Yes, Tracy. Hi.
Yes,
I'm Jennifer, the nurse here. Actually, I'm coming up for Madame Stephanie Laroche. She has a file here. The madam was like she was operated 2 weeks ago for a knee surgery, knee replacement surgery, but she's still in pain despite taking 24 milligrams of hydromorph. Okay, the diluted 24 milligram per day, but her pain is not totally controlled. She's still in pain. So I'm wondering if we can switch to another like opioid, or if you're gonna propose any other thing, it would be fine.
Okay, I see. So Jennifer, thanks for coming. First of all, may I please have a seat and make yourself feel comfortable. I like to help. So may I have the patient's full name and age, please?
Yeah, she's Madame Stephanie Laroche, as I said. She's 54.
54. Okay. Yes, I have the profile here, and I can see she's using hydromorphine 2 milligram tablets, 1 or 2 tablets every 4 to 6 hours as needed. So in total, so how many tablets actually this patient is using every day?
12.
12.
12.
Okay.
Yeah.
12. Yes. Okay. So 24 milligrams in total. Any other opioids she's using at this moment? Instead of this hydromorphine?
Tylenol.
Tylenol. Okay. Okay, and you said the pain is not under control at this moment. Am I correct?
No.
Okay, I see. And instead of the prescription on the list, any other medication this patient is using?
Yes, you have your file here.
Yes, just to double confirm. So what kind of medical conditions is?
What is what?
What kind of other medical conditions this patient is having at this moment?
She's having blood pressure, and she's asthmatic.
Hmm.
Asthmatic as well.
Asthmatic. Okay. Is that both under control right now?
Yeah, I believe.
Okay. And any allergies for these patients?
Not as much as I know, but the only allergy she had, like for the smoking cessation therapy, she got like a severe rash and something like that because of the Nicoderm patch.
Okay, it must be really bothersome for these patients. Okay, because of the patch. Okay.
Yeah.
So, what kind of opioid would you like to try? Like instead of patch, I guess this time.
Like for smoking cessation?
No, I mean like for the pain relief. So this
You
time we do
proposed it.
have like a transdermal.
I don't know what.
Sorry.
I don't know what type of analgesics you have here.
Okay. Sure. We can check it together. And so for these patients, 54 years old, and okay, and any of the counter medication instead of Tylenol?
No.
No. Okay. How about multivitamin or herbals?
What about what?
Multivitamin or herbals?
No.
No. Okay. And may I ask you a few more questions about the lab work?
Yeah, sure.
Is the renal function or like hepatic function normal for this patient?
Yeah, all is good. She's fine.
All is good. Okay. Is this patient drinking alcohol?
No, not to my knowledge.
No. Okay. And she is having a smoking cessation at this moment. Am I correct?
She used to.
She used to. Okay. Right now she's not. Okay.
Yeah,
got
she's
it.
not smoking now.
All right. Okay, thank you, Jennifer. Could you please give me a second to check my reference and the product on the table?
Yeah, sure. Go ahead.
All right, thank you. Can I check the product? Thanks. Okay, thanks, Jennifer. I just checked my reference. We can switch these patients from the hydromorphone to morphine. Is that okay? To morphine?
To morphine?
Yes, we can do that. Or
Yeah,
just give me
sure.
a second. This capsule is hydromorphine. Oh, okay. So we do have a fentanyl patch right now on hand. Would you like to transfer to a fentanyl patch? Is that okay?
I don't know, as you like, but as I said, she got reactive to the patches before.
Yes, I do notice that, but right now on the table, I only have like oxycodone, which is weaker than hydromorphone. So the best one, that's a stronger one, is gonna be a fentanyl patch. Otherwise, I guess we can increase the dose for hydromorphone. Both fine.
Okay.
Which way would you like to try first?
Oh, the oxycodone, can we use it?
Oxycodone is this one is weaker. It's a weaker opioid, so I think it's gonna be less effective. So 7 minutes.
How many
Time's up.
tablets she gotta
Oh, yeah,
take per
time's
day?
up.
So I didn't give the dose. No. How
Yeah,
many
time is up,
tablets?
time is up.
I would suggest.
Time is
Okay.
Okay. The time is up, Gazouly, or what?
Yeah, time is up. Yeah. So
Okay.
let's discuss it, guys. Let's discuss this on this station.
Okay, go ahead.
Did anyone has any comments? So I see here Ammar said 6 milligrams of hydromorphone content BID extended release, yes, plus the IR hydro. Exactly. This is the right answer for this station. So here I have some concerns. I like the Tracy, I like your assessment. It was very thorough, starting from you offered like a confidential private area until you went through everything in the patient profile. I believe it was really a thorough assessment in the beginning, and you made sure that the patient is not taking anything. But both of you, actually, you and Karen, forgot something. This guy, we usually, when we deal with such stations, we look on the big picture of the profile. This patient is asthmatic, okay? Plus, he's taking an opioid, which is not controlling for the moment his pain. So either or, you're gonna switch it to fentanyl patch, or even we're gonna switch it to hydromorph content plus IR. There is a risk here that no one even mentioned, which is the respiratory depression that may be applicable here, right? No one mentioned that. And that's called the patient care. So you're not focusing only on the dilemma of the concern. We're dealing with the whole picture as well. Yes, we're focusing on the concern, which is the pain control here, right? And Karen actually asked a very good question about the pain scale and stuff like that. Tracy didn't mention this. However, both of you didn't notice that other than focusing on increasing the opioid, what's going to happen? What's next? Is it only the pain? There's something called cascading effect, that you're going to treat something and then you're going to make something worse, which may happen here. You're treating the pain, that's right, and you're solving the concern, that's right, but it's not going to be fully solved. Why? Because you may mess up with another like medical condition like asthma, right? So what do you think we should do here in this situation? I didn't like mention the answer yet, but I'm just trying to highlight or have a spot on the on one of the main concerns in this situation too. In this case too. What do I think? We need it to be more interactive. So just go ahead and participate. Let's have a conversation.
Ask more about the pain when, if it's something make it worse, something triggered the pain in the end of the day or before the next dose.
What?
Like,
yeah, and there's another question. I agree with you, Karen. What makes it not controlled? What makes he's taking 12 tablets of 2 milligrams. What makes it not controlled? Should we ask a specific? Does he forget? Is it like to take it properly? It's a 12 tablets. That's a lot. Beside his regular medication, what makes it not controlled? Is it not enough? Should we increase it? All these questions, right? So everybody decided to increase it. You decided, Karen, to pump up the opioid to fentanyl. Okay. Did you do the math about fentanyl? Which one exactly are you gonna pick up?
no.
Why did you choose the 12? Why did you choose the 12.5? Is it because it's a lower?
Yeah, because it wasn't the like in the reference between. I get it from the reference, but I couldn't.
Okay. So when you dispense, so this guy is not an opioid naive. That's why you were comfortably advising about fentanyl. If you're going to advise on fentanyl patch regarding an asthmatic patient, what should you recommend? What are the consequences to give fentanyl? What?
Actually, I didn't notice the asthma because he already was on opioid. So, and his doctor prescribed an opioid for him. Do I have to?
Exactly. You shouldn't have to get it for granted, because you're recommending to increase the opioid. So any patient can be asthmatic and opioid, yes, but we have to counsel on respiratory depression, specifically if you're increasing the opioid, right? God forbid, thank God, nothing happened on the diluted, 2 milligrams, 12 tablets a day. What's going to happen with the fentanyl? Should we leave it for a chance? No. What we usually do to advise, if you're gonna give any opioid or any increasing in the dose for asthmatic patient, you have to advise him. Okay, listen, one of the main side effects is respiratory depression for this one. Okay, so if this happens, always keep that salbutamol in hand. Okay, get the Narcan kit for overdosing, risk of overdosing, right? All this, that's called a patient care. That's called you're seeing the big picture. You're not only focusing on the pain, and then you're leaving something important as well. That means that's not fully solved. So you have to wrap up everything, control every single point of the patient as in general. You got my point?
Yeah. Thank you.
Okay. Do you agree with me?
Yeah, I totally agree.
Yeah. Okay. So we didn't talk yet about the main solution of like the concern. Okay. However, here is usually, I'm not sure if you guys like familiar with like pain management or stuff or no, but usually in practice, we give like a content, okay, a content tablets like hydromorph content as a capsules, BID, just to maintain, or to decrease the threshold of the pain. And then during the day, if there's any kind of breakthrough pain, we give the IR. Same answer like Ammar said. It's as simple as that. We usually don't pump up the opioid specifically because, in Canada, we have a crisis in opioid, right? So we usually don't put him in risk of being more dependent on another opioid. We try to make sure that he's taking the full dose, the proper way first. If it doesn't go through or it doesn't help, and then we can step up another, step. So fentanyl here is not the best option. So we usually try first the capsules, BID, plus the rest of the 24 as an IR, because IR, it's like it gives like for like a couple hours and then it goes back again. Like there's no or like 3 or 4 hours like pain management, and then like the effect decrease. So usually give BID content as like an extended release during the day, and then we add IR tablets like for the breakthrough pain. And that's pretty much. And then you're going to add, you're going to ask about the vaccination. Is this guy, the follow-up at the end? Is this up to date? The vaccines are up to date? Yes, because it's asthmatic, right? The readings are good for his blood pressure and stuff like that? Yes, okay. So we make sure that we tackle every single point in just single small sentences. That's what's called patient care. We solve it, or completely solve it, as they say. So we solve it the concern in a proper way, and then we tackle the rest of the points of the patient, and pretty much it. Okay.
So I have a question. I have a quick question. Where I can find this info, like for 6 milligram BID from the reference, or should we remember it? Is that from?
No, we shouldn't remember actually, but he's taking the total quantity of Dilaudid he's taking is 24. Right?
Yes.
So
exactly.
if you give 9 milligram BID, for example, that's 18, and the rest he can take it as like, and then you can give him the rest as IR. Right?
Okay, so we can do that also, like 9 milligram BID also, okay.
Yes, and Mohamed mentioned actually like a very nice point here. Just to direct you, so usually make sure that the actor is, when we give you like an advice or like a comment, he's trying to direct you to some way. He's not against you. Okay, so if he said, okay, she used to use like a patch or something for smoking, and it was giving her a hard time. So don't apply the patch. Okay, so make it simple. Is the actor usually directs you to whatever the right answer is? Okay.
Okay, so let's wrap it up, Gazouly, to move forward, please, with the next station. So the ideal solution, guys, here would be with the BID, the extended release hydromorph, which is hydromorph content. Okay, so we can give 9 and 9, for example. 9 and 9 gives 18 milligrams, 9 in the morning, 9 at the evening. So it's gonna be 18 milligrams, and we can give few tablets of the immediate release hydromorph for breakthrough pain. Okay, we can go up to 24 milligrams. So what we can give, we give 3 tablets of 2 milligrams plus 9 and 9, it gives 24 milligrams. You can add another tablet like immediate release to go up to 26 milligrams if needed. With the patient may need to increase the dose a little bit. We don't know. So we can give 4 tablets of 2 milligrams plus 1 9 in the morning, 1 9 at the evening. This would be the best solution here. Why we cannot give oxycodone? and fentanyl. Fentanyl, the problem, she had a problem before with 2 type of batches while she was taking the smoking cessation therapy. She may be allergic to the patches, okay? And she got severe reaction, as the nurse said. I said that I got severe, she got a severe reaction. So the patches would be the last resort here, only when other options fail. Okay, so this is why we cannot give fentanyl. Why we cannot give oxycodone? I think Tracy said it's weaker, right?
It's weaker, yeah. Yeah, Tracy mentioned this, yes.
Yeah, it's weaker here. And you have the reference here. Okay, that's it. So oxycodone would be weaker as well. The patient is taking Tylenol in her file. If you can see, she's taking Tylenol. Okay, 2 tablets 4 times daily, and this one is like it contains as well acetaminophen. The option here is oxycodone plus acetaminophen. So we can give oxycodone so many tablets per day. This is number one. Oxycodone is weaker than hydromorph. Second thing, we have to make a change in her. We have to stop the Tylenol she's taking. Okay. This is another point. So the best solution, the easier, the most convenient would be to give the extended release hydromorph. Okay. That's it. I hope it's clear now. So let's move forward to next station. Station number 2. Okay, we need a candidate. Who's gonna be the candidate here?
Okay, Mariam. Sarah Taib. Anyone? Ammar.
I'm sorry, I'm
Yeah.
putting my daughter to sleep. I'm just listening. Sorry.
Oh, sorry, it's okay. No problem. Ammar, right?
Yes, I'm ready. Yes.
Okay, my friend.
So, doctor, I have a question, please. Back to previous case. Back to previous case, I have questions, please.
Yeah. What's the question?
So, do we have to do dose reductions? So,
Do you have
patient
what?
is
Sorry?
dose reduction. Do you hear me clear?
Yeah, I do have it.
I mean, a patient was on 24 milligrams hydromorphine IR, right?
Yeah.
So when we're switching him to a sustained release or XR, do we have to make dose reductions so it would be 6 milligram BID or 12 milligram BID?
No. Not 12. 12 is too high. 12 BID, that's 24. So there's no room here to put an extra tablets for IR, right?
Okay,
so it's either you can choose it. It's either you have 24 is your maximum, right? So if you would like to use like 6 milligrams BID, and then you can put the rest as IR, that's fine. We choose actually like 9 milligram BID, and the rest we put it like we give like 4 or something until it matches at 24. That's that 24 milligrams total.
Okay.
So
okay.
it's fine. But the main idea is like you have to add like extended release, right?
Okay, got it.
Yeah. Okay, let's start the session.
Yeah.
Is
I
there-
sent,
there's reference?
yeah. Send it to the Telegram.
Send it already. Okay. Yes.
Okay.
Just a moment, please. Okay, I'm ready.
Mohamed, you want me to do this?
Yeah, you can go ahead. I'm gonna keep
Okay,
it.
so start with the timing, please.
Hi, my name is Ammar from Assistant Duty. How can I help you?
Hello, my name is Mohamed. I'm a pharmacy student. I want to know some stuff about clozapine. why it's complicated? I heard like there are some side effect. There are main types of side effect of clozapine. Some of them are those dependent on, some of them are not. I would like to know which one is which, and if they will fade out by time or it's just permanent.
You mean for side effect?
Yeah, for clozapine.
So what's your name, please?
I'm the pharmacy student on duty, and my name is Mohamed. Yeah.
Okay, Mohamed. So do you need to ask specifically about clozapine side effect or general information about clozapine?
I heard like there's like it's too hard to handle this medication when it comes to treatment.
Right.
And some of the side effects are like those dependent, and some of them are not. So I would like to know which is which, and if they're gonna fade out by time or not.
Okay, sure. Sure, Mohammed, I'll help you on that. So, Mohammed, you know, clozapine is, I believe you know, this clozapine is under group of anti-schizophrenia, and taking this medication is mechanism of action, as I remember, is working on different receptors. It's working on dopamine receptor and alpha receptors and a lot of receptors, as I remember. So that's why this could causing a lot of effect, a lot of side effect. I mean, main side effect, clozapine is affecting white blood cells. And to let you know information exactly, let me check what I have reference, please, Mohammed, and get back to you.
Okay.
Okay, so this patients on your name. Okay, Mohammed. So, clozapine may not causing some of side effects, like it's common side effect, like sedation, drooling, cyalorrhea, and orthostatic hypotension, and all of these we can overcome by certain considerations. So, to overcome sedation, we have to minimize or reduce the dose. So this is dose dependent, or divided the dose over the day.
Okay.
Cyalorrhea.
So which one are those related? Sorry, sedation, hypotension, you said?
Yes, sedation is dose dependent, so we can minimize or reduce the dose or titrate the dose slowly, or even divide the dose. Okay, to overcome this kind of side effect. And orthostatic hypotension, same, it's dose dependent. That's why we can titrate slowly or minimize or reduce the dose. It can cause what we call tachycardia, increase the heart rate. So we can also avoid it by minimize and reduce and titrate the dose. And it may cause putting weight, so weight gain, and causing metabolic syndrome. So we can overcome this by through the controlling diet, exercise program, and it causes nasty constipation. That's why we always advise patient on clozapine to put him on osmotic laxative or polyethylene glycol, for example, once he already started the clozapine, as we doing always with opioid too, and advise patient to increase fluid intake, activity, exercise. And the most important, Mohammed, I would like to grab your attention about clozapine is the serious side effect, but it's not common. It's rare side effect, what we call a granulocytosis, affecting the white blood cells. That's
2 minutes remaining. 2 minutes remaining.
Okay, so the most important thing is that it's a granulocytosis. The good news, it is rare, but it's serious in the same time. That's why physician always require for patient to taking clozapine, regular lab.
You know what? I heard once patient is telling my supervisor pharmacist that one of our pharmacy patient is soaking his pillows at night because of clozapine. May you recommend something that to make this less bothersome to that patient?
Soaking his pills?
His pillow, yeah, it's like soaking his pillow, like drawing, stuff like this.
Yes, sure. As I told you,
Like
this
running.
is one of the effect, rolling and cellular. Yes, so we can overcome this one by placing a towel over a pillow at night, or chewing sugarless gum, and or minimize those two. And if
can we give medication for that?
Yes, if we're really bothering him, we can give him something as atropine sulfate or ipratropium nasal spray. So to help to dry this discharge as an anticholinergic.
Okay.
You get my points, Mohamed?
Yeah. Okay. I will. Yes. Thank you. I'll pass this to my pharmacist. Okay.
Okay. And do you like to know about the serious side effects and rare side effects like granulocytosis, or what's requirement for doing blood work from time to time?
No. Thank you so much. Thank you so much.
Thank you, Mohamed.
Okay, Ammar, you did very well, by the way. However, I have a concern. In the beginning, you were a little bit confused or overwhelmed of my questions. I feel so. I'm not sure if that's right or not. But to make things organized, because I just started asking right away. Okay, pharmacists want to know that if it's the clozapine is complicated, and what is the main side effect, if it's dose related or not dose related, if they're gonna fade out, stuff like that. So yeah, let's have things organized. If you got this opening questions, like non-stop opening questions, so take everything bit by bit. So you have to ask, are you asking for a specific patient or just in general? So I will tell you it's in general. Okay, so your questions are, reread it, questions are so and so and so. And then could you please like give me some time to check my references? And stay away from any guessing sentences like, I guess it was working on some receptors. I guess to my knowledge is working on other receptors. I felt that you're not familiar with the receptors that affected by the clozapine because the way you put it. However, I know that you know it very well. Right? Usually, don't say I guess. Don't say I'm not sure. Don't say it. Okay. But you after you check your references, you handled everything a concern very well. So I would give you fully solve it for this one. But however, in the beginning, for me, you were like a little bit confused and or overwhelmed. But very well done.
Okay. Thank you, because I was trying to recall what I know about clozapine without checking my references.
No, don't do that because the questions were too much. So don't do this. Write down the questions on your note. Reread it to make sure that you covered all the questions. Other than that, if you didn't cover any questions, it will be like a mark that you're gonna lose, right? So take it simple. It's a very easy thing, and you manage it very well. Okay, just be organized and don't overwhelm yourself. That's it. But you did it very good. Okay, but we're gonna move to station number 3 because this one is very well done. So any other candidate would like to participate? Jim, Rasha, Ravi, Sarah, Susan, Tayeba, Zoom user,
I want to
Galaxy
participate if nobody else wants.
Yes. Let's participate to this one, Mariam. Okay.
Okay.
Okay, guys. For station number 3, I'm gonna share you the reference to the Telegram group.
Okay, just let me know when you start the timer, okay?
Review.
Start, Mohammed, start 20 seconds and then scroll down so she can see what's going on. After 20 seconds, Mohammed, let me start. Tell me to start.
Yeah, go ahead.
Hi, my name is Mariam. I'm the pharmacist on duty. How may I help you today?
Hi, Mariam. I am Mohammed, the nurse on duty today. I have a question regarding one of our patients who was very well stable on the pain medication. However, 2 days ago, he started to have the pain back again. He said it's severe and there's no control like before and starts sweating and stuff. I don't know what to do. So can you, if you have an input, please help us with it.
Hi, Jenny. Thanks for stopping by. So just have a seat and make yourself comfortable. May I know the patient's name and age, please, to pull out his profile?
Yeah, it's right in front of you here. His name is Ryan James. He's born 1955.
All right. Okay, and just to be sure, you said that he was stable on a pain medication, and then 2 days ago his condition exacerbated. He has severe pain and sweating, right?
Yes.
So what is the cause of the pain, Jenny?
It's a chronic back pain, he said, and the doctor said, and he got diagnosed due to his weight. He's a little bit overweight to obese, kind of, so that's the main reason for his pain. However, he was stable on the opioid for some time, but he came and he's like kind of sweating and no pain management like before. We don't know the reason.
Swelling, you said?
Sweating.
Sweating. Oh, okay. So which type of opioid was he on?
He was on Tylenol number 3 for some time.
Tylenol 3. Right. How long has he been on Tylenol 3?
For quite a while, actually. It's like 3 months or something, and he was good.
All right. And is he an inpatient, Jenny?
No, he's an outpatient.
All right. So let me review and go over his information real quick. So serum creatinine is 0.9.
Mm-hmm.
And the patient has no known allergies. Blood pressure, all right. Okay, the patient is on amlodipine, lisinopril, Janomet, Decolazide, and Contrave tablets, and also Tylenol 3. So any other prescription medications, Jenny?
No.
And is he taking all the medications as prescribed?
Yes.
Any over-the-counter medications, herbals, multivitamins?
No, I don't recall anything. No.
Okay. And is the patient liver function normal?
Yeah, everything is normal, yeah.
Okay. Okay, and I hear you mentioned that 2 days ago things got worse. So any significant changes with the patient lifestyle? Anything, surgeries, trauma?
No surgeries and trauma, no.
All right. Is there anything else that I should be aware of, Jenny?
No, just we want to know the reason behind, like he said it was controlled at the Tylenol number 3, but now he's like he's suffering like uncontrolled pain, and that's it. And he was sweating, and he said like cremation and stuff like that for some reason. That started like around 10 to 15 days ago.
All right. Jenny, if you don't mind, I'm just going to check my reference and get back to you, right?
Okay.
Hi, Jenny, I'm sorry, I forgot to ask you, why is the patient on Contrave tablets?
Okay, so you asked the main reason of having like the pain. It is because, like I told you, he's in the overweight, obese kind of area, and that's why the doctor is trying to give him medication to lose some weight.
2 minutes remaining.
Oh, right. So, Jenny, I guess this is the reason why the patient has uncontrolled pain. So he's taken naltrexone. So probably this may be precipitated withdrawal symptoms of the opioid the patient is already on. So I'm going to ask you, is the doctor aware that the patient is taking an opioid before prescribing Contrave?
The Contrave is like, I don't think so. No, I don't think so.
So can we bring this to the doctor attention?
So what should I do then?
Then we just need to document this, bring this to the doctor attention to see what he can do. Maybe he can modify it, switch to something else. But meanwhile, he should take two of them together. I mean, Contrave and Tylenol 3. And this is probably the reason why the patient condition is not controlled.
Okay, so what should I do? Should he stop something, or should he? I ask the doctor first.
So just let me give it a bit of thought. But I think we should like hold Contrave temporarily until we speak to the doctor. Has he taken any doses today, for example?
Yeah, he's been on it for like 15 days.
Yeah, so he took a dose this morning, right?
Yes.
Okay, I think we should hold Tylenol as well, because them being together is not a good thing until we hear back from the doctor. And we can give him something maybe less strong right now. We can give him ketorolac, for example, or ibuprofen until we hear from the doctor, right?
Give him ibuprofen? Okay.
Now I can give him ketorolac or anything strong until we hear from the doctor. How does that sound, Jenny?
Yes, cool. We'll do that. No problem. Thank you.
All right. Thanks for involving us in a circle of care, and just let me know if there are any updates. Yeah. All right.
Thank you so much. Okay, time is up. Okay, thank you, Mariam, for your participation. Is there anyone else who would like to participate? Sarah,
I can, maybe I can try to do that.
Yeah. Okay, let's do that. No problem. Okay, Mohamed, let's start.
Let's start.
Okay. Hello, my name is Sarah. I'm the pharmacist on duty. How may I help you?
Hello, Sarah. How are you? My name is Mohamed. I'm the nurse on duty today. I'm here to take your opinion or your input regarding my patient Ryan James. His date of birth is like December 5th, 1955. He came here with a sweating and pain. He used to take Tylenol number 3 to control his pain for like 3 months ago, and he was controlled. However, he came recently today, complaining about the pain is back again, and however, he's like still taking the Tylenol number 3, and he has like sweatings stuff.
Mm-hmm. Okay, I see, and okay, have a seat, and yeah, we will discuss this concern. I see here the profile that the patient is taking amlodipine, lisinopril, Janamet, and glycoside, and Contrave tablet, and the Tylenol. For how long he had been on Tylenol? Tylenol 3.
He has been on the pain medication for like 3 months now, and he was very well controlled on that.
Okay, and nothing changed on his regimen, right? He's taking the same way, taking the medication. He's taking the medication the same way that he was used to.
Exactly, yes.
Okay.
Yes, no change.
Mm-hmm. And I see here that he's using the Contrave tablet 15 days ago. So he recently started on that medication. Is he?
Yes, he recently on this one. Yes.
Okay.
Is he what? Sorry.
Oh yeah, I was just asking about the medication he started recently, and you said yeah. Okay, so according to my reference here, this medication have naltrexone, which is convert the effect of the Tylenol 3. And I guess okay, and this patient is went through the withdrawal syndrome because the medication that he started using 15 days ago is blocking the effect of the Tylenol 3. That's why now his patient is not controlled and he starts to sweat because of this medication effect. Okay, so
what should we do?
Okay, and can I know why he's using this medication? The Contrave tablet.
Which medication? Okay, so he has been diagnosed for for back pain because of his heavy weight. So the doctor suggested to start Contrave tablet to decrease the appetite. So losing some weight, to help him losing some weight.
Okay, to lose some weight. Okay, I'll fax the doctor to let him know about the drug-drug interaction. And what I'll suggest to the doctor is to stop the Contrave or switch it to another drug.
Like what?
Okay, I'll check my reference, but just yeah, and he should start taking the Tylenol 3 at a lower dose to make the patient gets better from the withdrawal syndrome and to control his back pain.
At a lower, what dose do you want him to start? Like you said, at a lower dose, what dose do you want him to start on?
Okay, just give me a moment, please.
You want him to start Tylenol number 3 at lower dose? Like what dose do you want me to start him?
He's taking 3 tablets every 4 hours.
He's taking 2 tablets every 4 hours when needed. And that's in his file.
Okay, just give me a moment to check my reference and just to collect my thoughts.
Okay. Okay.
Can I know how many time left, please? Okay. He can take 1 tablet every 4 hours, and then we can increase that until his
1 minute remaining. 1 minute.
Yeah, until his pain control
From
again.
Tylenol number 3. From Tylenol number 3. Sorry, what did you say? 1 tablet every 4 hours.
Okay, sir. Sorry. We can stop the other medication that interaction with his Tylenol 3, and yeah, he can continue. Sorry, he can continue with his Tylenol 3 at the same dose, but we can stop the Contrave tablet. And I'll fax the doctor to let him know about the drug-drug interaction, and I can suggest another medication for the appetite, for the weight loss, like liraglutide, for example. I'll fax that to the doctor. And yeah, and I will follow up with the patient.
Liraglutide? Liraglutide?
Yeah, so just a minute. So you want me to suggest something to the doctor?
Time is
for
up,
the
guys.
mid-
Time is up.
You said I want to suggest something, so that's why I'm asking. I didn't ask you to suggest. You said I am gonna suggest something to the doctor. So you tell me so I can tell the doctor. What's you gonna suggest?
I'll text the doctor.
You're gonna fix the doctor. Okay, thank you so much. Thank you, sir. Thank you so much.
Okay, I think I messed up.
Okay, so Sarah, you were almost there. Like you were almost. I don't know why you're hesitant. You're right, but I don't know why you're hesitant. Okay.
Not decrease the dose, or
No, not decreasing the dose.
not decreasing the dose. Okay, yeah, because
No,
I
why you
changed my
decrease the
mind.
dose? He was
Okay, yeah.
okay. So this guy has many concerns. Number one, if you can check the A1C, it's above normal, right? So his diabetes is not controlled. That's number one. Okay. He's obese, right? Number two, right? And the concern is taking opioid plus Contrave. Contrave has naltrexone, so it's an antagonist to the opioid. So there is a withdrawal effect. That's number one. That's the main issue here. So please stop Contrave because we have another options to have this patient losing the weight. Like what? Non-pharm. What about his eating habit? Because he's diabetic, right? What about his exercise, right? All this, you forgot about non-pharm at all. No one mentioned any non-pharm. Okay. Number two, he's diabetic. His diabetes is not controlled, right? So what about starting Ozempic or Victoza? This group, one of the main groups that will help him to decrease weight. As simple as that. Why are you guys decreasing Tylenol number 3? He was stable on Tylenol number 3, 2 tablets every 4 hours. Why you offer decreasing Tylenol number? Someone said 1 tablet every 4 hours. What is the reference?
But then I changed it.
Why?
Yeah.
Why? What? Before that, it's Mariam, I believe. She said ketorolac. Why? Why ketorolac? And he's on
No,
diabetes,
I'm sorry. Just to clarify this,
blood pressure
I
medication.
wanted to hold it temporarily and give him something else to control his pain. I'm not sure this is right. I'm just explaining, you know. This is what I meant.
So if you're giving something, so you're trying to give something away from the opioid. What is stronger, ketorolac or Tylenol number 3?
Of course, Tylenol number 3, but I said we're gonna hold it.
Exactly. So
this is how I thought.
So why not control? Okay. So why not control? Why you not stopping? Why did you choose a stopping Contrave for the moment? Why? And you started to switch the opioid. So you're switching something that was working to something that we're not sure if it's going to work or not. However, it has an interaction. Ketorolac is not good with glycoside and amlodipines and lisinopril, and it's a chronic. It's not something you're going to take it for a couple of days and that's it. So we can agree on it. It's a chronic thing, right?
So if we just keep giving Tylenol, there is no problem. We just stop Contrave, right?
Yeah.
Yeah, this is a Contrave. This is the main issue here. He's been stable on the other medication, and the Contrave was a dilemma. So stop Contrave. Okay.
So I'm sorry.
That's
can you give me
one.
full assessment? Like, can you, after you finish, please give me full assessment of my performance, just for my reference, right?
Full assessment.
Like
yes, definitely.
Maybe.
Yes.
Okay.
Yes. Oh, for yourself. I know. Okay, I got it. Okay.
Thank you.
So no, regarding your assessment, no one mentioned the A1C is not. That's I'm gonna start with the missing part. No one mentioned the A1C is not controlled. Okay. No one mentioned that like his BMI is like is not good. He should decrease it. No one mentioned the non-pharm. No one mentioned if he's a smoking or not a smoker. Okay, so that's main 4 points that no one mentioned. Okay, regarding the
so the liraglutide was a good option.
This is the best option, my dear. It's not a good option. This is the best option. So his main issue is to lose weight and control the diabetes, right? So this is the only option. Why not we going for insulin, for example? Insulin can be a choice here or no? What do you think?
For his diabetes,
the body weight.
Exactly. That's totally
But
right.
weight gain.
So we didn't look to the main picture as a whole. So yes, we're gonna adjust the A1C, but his main issue is the pain due to his overweight. So we didn't solve this. So the only option or the best option here, beside the non-farm, which is no one mentioned, is having Ozempic or doing semaglutide or even anything that may help him on both sides. Okay, Mariam,
Yeah.
your assessment was good, but your outcome wasn't good because you offered an NSAID for a chronic purpose. However, it's going to contradict with the other medical conditions. So your assessment was really good, and you found the DTP, the drug therapy problem, but your outcome wasn't good. You got my point? And this is the main issue. That's what means like fully solved is not fully solved. Outcome wasn't good. However, you found the DTP, the drug therapy problem. So you found the interaction, but you didn't solve it properly.
Okay,
so you
I
have to
hear you. And what about
yourself
communication? I'm sorry for interrupting.
Your communication is very good. It was welcoming. Everything was okay. But my issue here is the outcome. The outcome wasn't good. And that's
So,
part of the game.
Yeah, I hear you.
Of the game,
So what if I just said we're gonna fax the doctor and wait for the recommendation? It's gonna be marginally solved.
You didn't do your job. Yes, exactly. It's marginally solved. Yes, don't put everything on the shoulder of the doctor, because the doctor gonna get back to you. What do you recommend, right? So. Yeah, it's not going to be like a game here. He wants you to recommend something, and usually in practice, if you're practicing in Canada, they don't know. They want you to recommend. Seriously, if you're going to fax them something, put the recommendation. 1, are you going to recommend this? 2, you're going to recommend this. Please, please confirm.
So I'm sorry. What about me? Even though I was hesitate a bit, but what about mine?
You were hesitant and unorganized, but your outcome was very good. You said loratadine, I believe. Right? And I tried to repeat it to make sure that you did it right, but you were like, oh, let's get back. Yeah, I know. I didn't mean to do. You were almost there. I'm telling you. You're almost there. You found the DTP. You're trying to stop. You said, yes, you're going to stop it. That's right. Okay. And we're going to add loratadine to improve the HA1C. If you said that, did 3 points, I would give you 4 marks. Okay. Okay. So again, try to look on the main, the full picture of the patient. We're trying to fix the patient. We're not trying to fix only a DTP or only a one concern. Okay, because let's be frankly speaking here. What is more dangerous, the diabetes or the back pain? Diabetes may kill him, right? Okay.
I have a question. So this patient, so this patient is using sitagliptin with metformin. This is DPP-4 inhibitor, and right now, if we want to give like GLP-1 agonist, is that a good option? Because DPP-4 and the GLP-1 is not recommended to use together.
I agree with you, but I see in practices specialists they give both. Specifically these days, because Ozempic plays a great role in decreasing weight. So I see a lot of prescriptions does that. And by the way, I'm not sure if you're practicing in Ontario or not. The government here, the ODB, does not gonna cover the Ozempic unless you're using at least two diabetic medication and it's not doing the role properly. If you're using 2 and you still A1C is high, so you can add Ozempic, so the government can pay for that. So that's one of the main characteristics to using Ozempic. Yeah. So that's in Ontario. Okay.
I see.
Yeah.
I see. I would suggest to this patient to use another one to control the blood pressure also, like SGLT2, because I saw the diabetes patients also have 128/84. The blood pressure is still not under control. It's a 120.
Here the pressure is not controlled.
Yeah, 120/80.
Over 84, exactly. It should be below. That's sorry. Yeah, it should be below. Yeah, but again. So if you mentioned like non-farm, no one mentioned non-farm. That's very important. You have to ask about diabetes, blood pressure. make sure that you hit on non-farm as well. Okay, it's not very high. It's a borderline, we can say. It should be below 130/80. Here is like 184, so it's like kind of borderline. Okay, it's a very good point. Very good point, Tracy. Very good point. Okay. So let's any other question before we're moving to the fourth station?
Yeah, I have a quick question. So when they want us to make recommendation, does this depend on our knowledge, or they give us like sources for diabetes, medications, and so forth?
They assume when you go to the OSCE exam, they assume that you're practicing.
Yeah.
And it's written in the PEBC website. So they want you to be practicing before you're going to the OSCE. So what does it mean by practicing? You have to see prescriptions. You have to know what's happening because it's, as I said, it's a patient out care. So it's not only 1 + 1 = 2. There are another stuff you have to take care of. There's another like occupation, for example. So you have to collect all this knowledge. You're fixing a patient. You're not fixing only the problem. If you're gonna fix the problem, let's say, for example, I'm gonna give amitriptyline for a truck driver to quit smoking. You're doing good job? No. However, amitriptyline is one of the second or the third line for smoking cessation. However, he's a drug driver. So amitriptyline, one of the main side effects is dizziness, drowsiness. So he gonna he be in an accident on the road. So he didn't do good, right? So you have to look to the main pictures. That's why they are always assuming that you're doing practicing before you go. And actually, I don't think Ozempic need much of a knowledge. If you're reaching the OSCE, that means you know what Ozempic does. Okay. Let's go for the other.
Okay, thank you.
The other station. Mariam, for example, if you know the station that has oxycosate, oxycosate and acetaminophen, it doesn't if you do not know that 4 grams are the maximum dose for acetaminophen, that doesn't need like a reference. I mean, if you don't know the maximum dose of naproxen, doesn't need a reference. That's a big thing, that you go into like a station like this without knowing this little stuff. That's basic kind of thing.
Yeah, but I don't want to take much of your time, but the thing is, I'm not familiar with trade names, so I feel stuck. Like sometimes stations, a patient might say,
no need for trade names. No need for trade names. That's why Contrab, if you check in the reference, it has the ingredients.
Yeah, I know.
No need for trade names.
When you say
Ozempic, not
I
stuck
didn't
in
know.
a trade name. But I'm saying, yeah, semaglutide and liraglutide. This.
I see.
This group. Yeah, it's a decrease. They decrease the appetite actually, and make sure that that you lose some weight, and it is very popular.
Yeah, I know.
Buying Ozempic
the active constituent. I know. Yeah. Yeah.
Okay. Actually, this case is I went through this case in practice. So I have this patient actually. So let's go, Mohamed, please, for the fourth station.
Okay, let's go, guys. Let's move on. Fourth station. Here we go. I'm gonna send you the reference as well. Station number 4. That's it. Sent. Very good. Okay. Are you ready? Gazouly, go ahead.
Yeah. Who's participating, Shabab? CS, Jim, Russia, Ravi, anyone? Galaxy A10s.
I can do that.
Taiba.
Yes,
Let's
my
do
name
that.
is
Okay. Your name is, sorry?
Tayyaba. Yes, Tayyaba.
Tayyaba. Okay, where are you from, Tayyaba?
Currently, I'm residing in
Where?
Edmonton,
And
but
you
from
know what
back home,
Taiba
I'm
means
from
in Arabic?
Uh,
Oh,
yeah,
I
I
bet you're
think
from Pakistan. Yeah.
Sayyab. Yeah, yeah.
Taib is like kind person. Are you a kind person?
I was
I
kind,
hope
but
so.
since I have these two kids,
You was before going to OSCE. I agree.
I am actually.
Okay.
So
Okay. So this
how
station is
Really nice
I'm not sure if
name.
Mohammed send you the reference.
Yeah,
um
already sent.
yes,
Okay. First
Okay.
in
Okay.
to
Rob.
22nd, Mohammed and the sister.
Yeah, I got it. That's
Yeah,
Aerobica.
exactly.
Yes.
Do you practice? I believe you're practicing.
No,
You practice,
unfortunately
right?
not. Yet. No, no. I'm so sorry, not. It's my first attempt for
Not
the
in any
OSCE.
pharmacy?
No, I did for a couple of months on choppers,
Okay.
but then I started working,
Choppers?
preparing for this OSCE exam, and I just for me, I thought I need some brush up
Yeah.
because I completely forgot everything what I did in the MCQ. We have so many things going on with the kids in our life, so
Did you
that's
pass MCQ or not yet? Did you pass MCQ?
yeah, I did.
Oh yeah,
Yeah,
for sure.
I did.
Did you pass MCQ? Awesome.
Yes,
Awesome.
please.
Okay. Okay. So you passed like 90% out of the game. So that's good for you. Okay.
But
Okay.
I've noticed
Let's
that I
start
listen.
Aerobica.
Yes, please.
Okay.
Okay, guys, let's start.
Mohammed, can you scroll down, please? Or let me
Yeah, I
finish it.
cannot see the door now. Yeah.
This
Yeah.
is a
What's the
door.
door?
Okay.
Okay,
Yes, please.
this is a file. There we go.
Johnny Depp. Okay. And I can start now, I believe.
Go ahead. Yeah, Gazouly, go ahead.
Hi, my name is Sayaba and I'm the pharmacist.
Hi. May I speak to the pharmacist?
Yeah. Yes.
Hi,
My
my
name
dear.
is
My
Sayaba.
name is Mohammed. I'm the pharmacy intern here.
Okay.
Yeah. I have a question regarding one of our patient. His name is Johnny Tab. He's a respiratory patient, and his doctor sent him with an Arabica device. But he called us, and he seems like he doesn't believe that this machine could help him. He used it once or twice after his puffs, but doesn't seem working. He wonders if there's any medication in this device, or he should buy a specific capsules or something need to be installed in that device or no?
Oh, okay. I will try my best to help you out. You can have a seat here, and we can discuss this one further. So, Mohammed, you told me everything about the patient Johnny. I can see that he has this COPD, and he's using Ventolin, and he has used this Ellipta, I believe. He got it 14 days ago, and he's still taking this medication.
Yeah, he's still on the trilogy and the Ventolin offers as well. Yeah.
Okay,
Yeah.
and
But he added, his doctor added the Aerobica device, but he just got
okay.
like a week ago. But as I
Okay.
told you, he seems like he doesn't know if it's working. He's thinking that there's no medication, or he should buy a medication to install it in the device. Or what's happening? Yeah.
Okay, I believe that he's having this problem because it's the first time for him, using the device. So maybe he can have the problem. We can discuss that further.
Exactly.
I think the doctor has prescribed this one because his COPD was not controlled with the two medications he's using. Yes, please.
Exactly.
With, okay.
Yes.
And he was using this Ellipta regularly as prescribed, and it wasn't working. Do you know anything how many Ventolin puffs he's currently using?
He's taking now 1 or 2 buffs a day.
Okay, and is he a smoker by any chance, if you know anything about his lifestyle?
No, he's not a smoker.
He's not a smoker. Okay. Any other medical condition? I can see that he's using atorvastatin and alendronate. Any other over-the-counter medication he's currently using?
No.
No. Okay. Perfect. Just give me a moment, Mohammed. I will check my reference and I will get back to you. Okay.
Okay.
Thank you. So thank you so much, Mohammed, for waiting. And this device is actually an add-on as the doctor gave him. Usually, we used to give this device to the patients to excrete out, the extra sputum, because in the COPD patients, we know that this is the main cause. It can when the sputum is quite a lot that's accumulated in the chest, it is a good source. The bacteria can grow. So this device don't need any medication. It is just to expel out the mucus. This medication, and it has the way it works is that when the patient exhales through the device, he feel quick impulses and resistance when he used to exhale, and this pulses of resistance hold the airways open and help to shake the excess mucus loose and push it out. So
Okay.
this is the way it works. Do you know anything, his the other two medications? By any chance, do you know why maybe the doctor has told the patient that why he's prescribing this device to the patient? Is
He said along with the other buffers is going to help him improve his COPD situation. That's what he said.
Okay.
But there is no medication needed for him to buy for this
Yes.
buffer, no?
That's
No,
right. That's right.
Oh,
Yes.
oh.
And he don't need any medication. It is just the impulses which is generated by this device. It will help to expel out the sputum. This is how this will work. I can go through. I have this brochure. I can also hand over this brochure. You can hand over
please.
this one to the patient. Maybe when he will go through the information, and if he have any question, he can give us a call anytime. And if you want me, I can also go through this brochure right now, and I can
just bits and pieces out of it, like the main ideas. That's it.
Yeah, that will be great.
And I will pass it. I will pass the brochure to the patient as well. So.
That will be great. That will be a good idea. You can definitely do that. I was just wondering if you know that if the patient's condition should be controlled with the two puffers, because this device has no medication. It is just an add-on. I think that maybe is just the expulsion this device doctor has given him. If you think that after using this device for a week or so, if he cannot feel better, then I think he should go to see the doctor, because we have a lot of other inhalers and devices for the COPD patient, because this condition should be controlled. It can cause, there are many acute exacerbations, so it should be controlled. We have this brochure. We can definitely go through this one. So this is easy. It has this you have to ask the patient to inspect the device carefully, and he has to ensure that the resistance indicator is on the prescribed setting.
Okay.
And then he should be comfortably seated. He should close his lips tightly around the mouthpiece and inhale through the device through the deeper breath than normal, and do not totally fill your lungs. Hold your breath for about 2-3 seconds and breathe out actively but not forcefully. Just make sure that during the exhalation, ask him that keep his cheeks, it should be flat and firm. And continue taking the deep breath and long exhalators for 10 to 20 breath, and then perform 2 to 3 half cups he should try to cough it out to clear
Okay.
the airway.
Okay.
And he can do this one in the whole cycle for 10 to 20 minutes. And he can use this device twice a day. And if we
Yeah.
think that his COPD is not controlled, maybe he can see the doctor. And if in any question, anytime, you can ask him that he can come to the pharmacy. Maybe we can demonstrate the device as well.
Yeah. Okay. Okay.
Okay. Any question for me?
Time's up, guys.
No, thank you so
Okay.
much. Thank
Thank you so much. Thanks a lot.
Okay. Tariba, it was really very good, but you missed a very important something.
Yes, I was thinking that there must be something. It is not just the device. Maybe
No, it's only the device. It's only the device actually. But
only the
but
device.
yeah, it's only the device. There is no interaction, nothing. It was educational session. But a COPD patient, usually we have to hit on 2 points. Okay, to take the full
Okay.
mark. I feel so bad that I cannot give you the full mark because you didn't mention the vaccination. That's number one.
Okay.
So you have to make sure
Yes.
that he's fully vaccinated, and it is like you can. It's a health promotion module,
Yeah,
If
that's right.
so yes, and what else? You mentioned the smoking, I believe. Did you mention the smoking?
Yes.
Okay, so
That's the
that's
only
good.
thing I
Okay,
mentioned actually.
okay, okay, and the non-farm. So always mention the non-farm and the vaccination. Okay.
Okay. So
How
for
to
the
use?
non-form, are there any specific non-forms for the COPD patients?
There
Yes.
is a specific non-form if you see for COPD patient.
Okay.
Maybe negative smoking. If there's someone is actually
Around him, yeah.
like smoking in the house or something, yes, that's yeah, secondhand smoking is one of the main exacerbating factors. It may happen. Okay. Other than that, you did it properly, actually. It's Karen. It was not a nurse station. It was an educational station for a pharmaceutical or a pharmacy intern. It was not a nurse station. Okay. Ravi
Yes.
has a question. How to use device is missing. Actually, she mentioned every single thing regarding the device. She replied on my concern that she does not need any medication in it. However, it works by difference in pressure. And she mentioned how to use the pressure along with the trilogy and the Ventolin, which was very important. So it's an add-on physical therapy. It's an add-on therapy. It's not medication therapy. Okay, so there is no medication. Okay, so the point of the aerobica, if someone didn't see it in the pharmacy, it when you exhale in the device and you do like half cough, like this, this difference in pressure will loosen the mucus in your chest, and then you can spit it out. So opens up or cleaves up the airways. That's how aerobica works specifically, along with the trilogy and the Ventolin. It should be controlling the COPD situation and decreasing the risk of exacerbation. Okay, and she mentioned all this. Just highlighting, make sure, guys, if someone has autoimmune disease or pregnant women or asthma, for example, always ask this question regarding is all the vaccination are up to date, and that's it. And then you got hit the mark for health promotion. Okay, don't forget this point. It's very important. Any other question? Thank you so much. Actually, it was very thorough. It was very good. You handled very proper. Thank you for your participation time.
Thank you so much. So for
you
this
very
one,
So
because this
yeah,
was the pharmacy intern. So even with the pharmacy intern, we can ask the patient lifestyle question like vaccination and smoking, because we think, we assume
ask
that
as
the
much. Yes,
person,
exactly.
he should be
No,
aware of
ask as
these
many
things.
questions as you feel comfortable
Okay.
with. 100%, because the one who the other guy who's a monitor guy, he gonna like check marks. There is a checklist
Okay.
he has to fill. You know, okay, she asked about the vaccination. She asked about this. She asked if there's any interaction. She asked about the allergy. What kind of allergy? What is the reaction of that? You know,
Mhm.
he will check
Yeah.
everything. If you miss anything, that means that's a missing mark. Okay, so feel free to ask whatever question you want. Do the whole scheme. It's fine. Okay.
Yes.
So
And
do
you
the
think that
things really.
situation is marginally solved because I didn't ask about the vaccination. Just this
No,
point
it's
or
not
any
marginally solved. You did it properly, frankly speaking, but it's you did
Okay.
it very well, 100%, seriously. But I just want you to. I didn't mean to let you down, but I'm
No,
telling
no,
you
thank you so much.
to highlight
That's
the
fine.
vaccination part is very important, guys.
Oh, yes,
The vaccination,
that's
specifically these
and
days, you know.
yes, yes, the chronic
So it's very
conditions
important.
definitely ask
Yeah,
that. And
yeah,
you think
yeah.
that in the brochure, like and in explanation part, I missed something, or that's and this is
You didn't
how
miss anything. You
further
didn't
revise.
miss anything.
Okay.
However, I like it more when you acted in a friendly way. Okay, listen, I'm
Yeah.
gonna pass on the main highlights. However, I will
Yeah.
give you the brochure and let the patient. That's a real patient care, and let the patient talk to us as much as he can whenever he has a question. So you give him an aid to help him to read, just in case if he miss any of your point that you mentioned.
Oh,
So it
thank
was
you
very
so
proper, seriously speaking.
much. So
Yeah,
much.
yeah. So,
Right.
any question, guys? Any other question? Anyone want to mention or add anything? Okay. Thank you, Ammar, ومريم ورشا, everybody, whoever, وسارة, وطيبة, Tracy, everybody who actually participated. Karen, طبعا, whoever participated with us. I hope it's helpful. It was helpful and beneficial for everyone. That's the end of. We did 4 stations today for regarding hospital setting, and I believe we're done for now. If anyone has any concern or any question, just shoot it before we close the session. Mohamed, if you have any question, just let us know too.
All is good. Everything is fine. Thank you so much, guys. Okay, hope you extracted some benefit from this session. And that's it. Feel free to ask any question whenever you have on the Telegram group. You will find our numbers, everything is there. That's it.
Yes, we will
Thank
post it on
you.
YouTube. I think Mohamed usually posts it on the YouTube. I think so.
YouTube,
Yeah.
yeah.
So as you see, it's a straightforward. Just make sure that you're treating the patient, not only the concern. Okay. You can speak whatever language you want with a healthcare provider. Like complicated language is fine. Scientific language is fine. It's totally different if you're gonna speak to another like a patient or something in consultation sessions. That's totally different story. Okay. Asking about like if it's inpatient, outpatient, ask as many questions as you can to make sure that you're reaching your goal or your answer. I think that's pretty much it. Straightforward. It's usually easier, one of the easiest stations in. It's either the easiest or the hardest in the exam actually. So if you have